Welcome to California Care. Today we are going to talk about an inhaler. The brand name is Ventolin, it's salbutamol. It comes in a dispenser, which is also an equipment device which lets you or the patient breathe the vapor from the medication. The way you want to do is, I'll show you a little later how it is labeled. You pop the cylinder inside, make sure you check the expiration date on it to make sure you know which date it is. You pop it inside and then remove the cap beforehand before you store it for usage in emergency. Reason I would say that is normally people like to hold at the larger end, and here actually if you try to hold and remove from the top, the cap is going to lock onto the container. This cap is supposed to be removed from the side by pinching. When you pinch it, it comes off. But in an emergency, people are not normally thinking, and then things go wrong. And if you waste a few seconds, you can waste a precious life. So try not to have the cap on. Keep it in the container, but don't have a cap on it. We would like to place this right next to our emergency kit or oxygen on the wall, where we also keep a juice container or two to make sure that we can treat hypoglycemia in case the need arise. I'll go ahead and show you that next. As you buy one of these, you will notice that the container already has a pre-printed label, and we can cut that label off of the box and use it in a Ziploc bag. But you want to make sure you keep an eye on the expiration date. Here the expiration date is 2025, July 19th. This is a dispenser, and that's the cover for it. If you see the notches inside, if you squeeze the top and the bottom, it's going to lock on even more. So that's why I recommend keeping the cap off of it, so you don't run a loss of time when you're trying to use it on the patients. Well, the idea to assemble it is you put it in a Ziploc bag, you cut out the label along with the name, the quantity, as well as the expiration date, and you paste it on the inside of the Ziploc bag so you don't end up losing it. If it is on the inside, it has nowhere to go. And then you'll take all of your apparatus. Once you have assembled it, you want to assemble it by putting the cylinder inside, and now you're ready to use it, and you keep that into the bag right next to the patient. This being our treatment area, right next to the treatment area is where the oxygen cylinder is located, as well as the Ventolin that we have. We also have a fully assembled manual resuscitator with the oxygen supply. The cannulas are already put on to make sure we do not use any precious time when the patient needs it. So we're ready to go quickly from the bag straight to the patient's mouth. It's already connected. All we need to do is turn on the oxygen from there, control how many liters per minute we need to give, and we can give the oxygen to the patient. We also have anti-set. This is for people who are having cardiac pain. It's taped onto the oxygen cylinder. We have a blood pressure monitor, although it's a digital cuff type, but in emergency it gives you a fairly reasonable reading. We have pulse oximeter hanging right here, as well as the stethoscope. And this in the back, we have taped our bag of Ventolin. Salbutamol is hanging on the wall. Plus we also have two juices, not one but two. In case somebody goes hypoglycemic, we can go ahead and give them that to make sure that we take care of them. Now I will show you how to use the ventilator. So as you take the container, we assemble it like this. And remember, you don't use it like perfume and it doesn't go in the neck. It goes kind of upside down. So you'll be able to use your finger to push it down. This part goes in the mouth, and you tell the patient, normally the patient knows themselves, they take the deep breath into the lung and they hold it. And the way you do it, you dispense it by going to you press on the top and a puff comes out straight. And this puff they take into their lungs, and that's how they use it. 1 or 2 microdoses are enough to release the congestion they're having in the throat or in the chest to breathe. Remember, this is not for cardiac conditions. This is only if they're having difficulty breathing and they are allergic to something, or they're having an asthmatic attack. For cardiac problems, when they have shortness of breath, of course you're going to go to anti-set, nitroglycerin, and things of that sort. I hope this helps, and we'll come back to you with another video to help you practice better. Thank you.